Come in.
Hi, Ms. Bridges. My name is Quinn. I'm going to be a family nurse practitioner student today. What brings you into the clinic?
Well, I'm just here for my yearly physical.
Okay. Well, today we're going to be doing our cranial nerve as well as our neurological assessment. Let's start with some neurological assessment. Can you tell me your first and last name?
My first name is Krista. Last name is Bridges.
Okay. And what's your date of birth?
It's December 25th, 1988.
Okay. And I'm going to ask her some questions now that everyone should know just to check her neurological status. Just simple questions. So my next set of questions is going to be simple, just as I said. And it's just simple general questions that everybody should know, okay? Just to still check your neurological assessment, okay? Who's the president of the United States?
Joe Biden.
Okay. Can you tell me what day it is?
It's Sunday, February 19th.
Okay. And can you tell me what type of place you're in right now?
Doctor's office.
Yes. Okay. And last but not least, can you spell the word world?
WORLD.
Okay. Can you spell it backwards?
DLROW.
Perfect. So I would say her mentation status or her neurological status is intact. Next, we will start with our cranial nerve assessments, okay? We're going to start with trigeminal, cranial nerve 5. With cranial nerve 5, I'm going to ask you to, you don't have to do it right this second, okay? I'm going to ask you to close your eyes and I'm going to lightly touch each side of your face, okay? With a little small 2x2 gauze, okay? And with that, I just need you to tell me where I'm touching, okay? And also let me know if it feels the same or different, okay? We will be assessing her ophthalmic, her maxillary, and her mandibular areas of her face, okay? After we assess her face there, we will also have her to bite down or clench so I can test for symmetry here. And last but not least, we will also test her corneal reflex, okay? Now, may I please ask you to close your eyes tightly for me? All right, my dear. Can you please tell me where I'm touching?
Left side of my forehead.
Okay.
Right side of my forehead.
Would you say that feels the same or different?
Same.
Okay.
Right cheek.
Okay.
Left cheek.
Would you say it feels the same or different?
The same.
Okay.
My right chin area.
Okay.
Left chin area.
Would you say it feels the same or different?
Same.
Okay. Perfect. Next, can I please, oh, thank you for opening your eyes. Can I please ask you to bite down really tight, okay? And we're testing for symmetry, and it is symmetrical, okay? Next, we will test her corneal reflex, okay? So I'm gonna lightly touch your eye, and we'll see if your corneal reflex is intact, okay? Just look straight ahead at me, okay? Perfect. Corneal reflexes is intact, okay? Next, we will test our cranial nerve 7, which is our facial nerves, okay? Miss Krista, can I please ask you to smile really big? Perfect. We're testing for symmetry here, okay? Next, I'm going to ask you to frown. Good. It is also symmetrical, okay? I also want to tell why I asked her to smile big and to frown. I was also notating her nasolabial folds as well, if there's any abnormalities. However, it is symmetrical, okay? Can I ask you to puff out your jaws? Don't let me overpower you, okay? Good job, good job, good job. Last but not least, can I get you to close your eyes really tight and don't let me open them, okay? Good job. Perfect, perfect. So that is cranial nerve 7, which is our facial nerve, okay? Next, we will do our cranial nerve 8, which is our vestibular cochlear nerve. Excuse me, that is a tongue tire. I'm going to test her acuity, okay? Miss Krista, may I please ask you to occlude one ear, and I want you to say out loud the word that I'm saying to you, okay?
Okay. 99.
Opposite ear.
Emergency.
Perfect. So with that, we tested her auditory acuity, okay? Next, we will assess her hearing, again, with the tuning fork, okay? And with this test, we're gonna do the Ryan's test. What I'm gonna do is I'm gonna strike, press it here. She will notate any vibration if she feels it, okay? And she will let me know when it stops, and it also lets me know if she hears a sound in the ear once the vibration stops, okay? So all I'm gonna do is put this, I'm gonna strike my hand and I'm gonna place it on that on the back of the mandible here. And then I want you to let me know when that vibration stops, okay? And then you let me know if you hear something afterwards, okay? All right.
It stopped.
Okay.
Yeah, I hear.
Okay, perfect.
It stopped. I hear.
Perfect. So our cranial nerve 8 is also intact, okay? Also with the Weber, we can also test it there as well. With the Weber test, you will actually place it on the forehead, and she would also notate if there's any symmetry. Sometimes you can hear it or feel it on one side, but not the other side. But again, it will be if she feels it on both sides. Do you feel it on one side or both sides?
Both.
Perfect. Was our Weber test. Assessing cranial nerve 8. Next, we will assess cranial nerve 9, which is our glossopharyngeal. I'm going to ask Miss Krista to open up and say, ah. 2 seconds. Okay. Open up wide and say, ah. Perfect. So that's cranial nerve 9, okay? Next, I'm actually, since we're already at the mouth and assessing our glossopharyngeal, I'm gonna assess a hypoglossal cranial nerve 12, okay? Since we're already at the mouth, okay? I'm gonna ask you to stick out your tongue, okay? Move it from the left, move it to the right. Can you move it up? Can you move it down? Perfect. And that is cranial nerve 12, which is a hypoglossal. Next, we will do cranial nerve 11, okay, which is our spinal accessory, okay? I'm going to, actually, I was going to try to stand behind you so we could see, but I'm going to try to stand to the side if that's okay, okay? I'm going to place my hands here, and I'm going to get you to push your shoulders up. Try to push against me. Perfect, perfect, perfect. And next, I'm going to ask her to, I'm going to put my hands on one side of her face and have her push against so I can assess her sternocleidomastoid, okay? So I'm just going to lightly place my hand here, and I need you to turn turn away from, like turn towards my hand, fight against it. And we're assessing the sternocleidomastoid here, looking at the strength, okay? And can we get you to repeat on this same, the opposite side? Perfect. We see a sternocleidomastoid here. Perfect, dear. And that again is that again is our cranial nerve 11, our spinal accessory. Next, we're going to assess her sensation. Okay, I'm going to take a tongue depressor and lightly touch, and she's going to tell me if it's the same or different. All right, my dear. May I please ask you to close your eyes? All right. Do you feel this?
Mhm.
Is it the same or different?
Same.
Okay, keep your eyes closed. Is this dull? Would you say that's dull or sharp?
Dull.
Okay. Is this dull or sharp?
Sharp.
Perfect. Let's see this arm. Would you say that's dull or sharp?
Dull.
Perfect. Would you say that that's dull or sharp?
Dull.
Okay. Dull or sharp?
Dull.
Okay. Dull or sharp?
Just dull.
Dull.
No, sharp.
Okay. Gotcha. Perfect. So we just tested her sensation, okay? Sorry. Next, we're going to test her reflexes, okay? We're gonna do her biceps, her triceps, brachioradial, patellar, Achilles, and her plantar. All right. So I'm gonna do test the reflexes on our upper extremities, bilateral sides, and then I'm gonna go to the lower extremities. Okay. Now, if I can get you to relax your arm. Perfect. 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 All right, I'm gonna get you to relax your hands there. Perfect. Perfect. Reflexes are great on both upper extremities, okay? Next, we're gonna do her patellar. Perfect. Perfect. Now I'm gonna bend your knee, sweetheart, and bend this knee for me. And I'm just going to test your Achilles. Perfect. Perfect. Reflexes are great on both sides of her lower extremities as well. Next, I'm going to test her Babinski reflex, okay? So what I'm looking for is testing a Babinski reflex is I'm going to start at the base of the foot on the lateral side and advance across and look for a reaction in her feet, whether it be a spanning of the toes. That will be a positive reaction to her Babinski reflex, okay? If there's an abnormality, that needs to be followed up. Okay, I'm gonna bend your knee. There we go. Perfect. She did move her feet on both of them, so her Babinski reflexes are both positive, okay? Next, we will test her motor function. This is the fun part of our exam. I'll test the fun part because you get to move around this and makes the patient feel more involved in the actual assessment, okay? Now, for our motor assessment, I'm gonna be doing a couple of things, my sunshine. Okay, so we're gonna first start with her head. What I need you to do is chin to chest. Trap my hand. Good job, good job, good job. And then I'm gonna do the same in the back. Good job, good job. Do it on this side. Good job, good job. And do it on this side. Good job, good job. Next, we will get you to outstretch your arms. If you want to stand up, you can. Okay. Outstretch your arms for me. Push them up. Good job, good job. And push them down. Good job, good job. For this next one, I'm actually going to get you to take your arms and do this. Pull me. Good job. And push me away. Good job. Perfect. One more time, we'll get you to have a seat for me. I'm going to start to do your knees, okay? Push me away. Good job. And pull me. Good job. For your lower extremities, push me away. Good job. And pull me. Perfect. Last but not least, our feet. Push them up. Good job. Drive the car. Perfect. Those are our motor skills. So next we're going to be testing our cerebellar function, okay? I'm going to change my gloves, okay? With our cerebellar function, we're going to be doing what we call the finger to nose test, okay? That likes to affectionately be called sunshine. That's why I keep saying that. Okay, so with this test, I'm going to get you to, you see my finger? Okay, I'm going to ask you to take your left hand and touch my finger, then touch your nose. Touch my finger and touch your nose, and again, and your nose, okay? I'm going to ask you to do it this time with your eyes closed, okay? Touch my finger, close your eyes. Touch my finger, touch your nose. My finger, your nose. Last time, finger and nose, okay? Oh, you can open your eyes. We're going to do the same with the right hand, okay? Touch my finger, then your nose. Again. Last time. Perfect. Now I'm going to ask you to close your eyes and repeat the same test. Touch my finger, then your nose. My finger, your nose. Last time, my finger, and your nose. Perfect. Cerebellar function is intact, okay? Now we will do what we call the Romberg's test, okay? Now, I'm going to ask you to stand, feet together. I'm going to ask you to hold out your hands like this. And close your eyes for me. And then I'm going to let go, okay? Perfect. Just to check up for symmetry, okay? Make sure there's no wavering in the limbs, okay? All right. Next, our very last test is going to be our gait test. This is also the fun part of our test because you get to walk a little bit. Okay, so I'm going to ask you to, with both feet, well, of course both feet, but not like with one without the other. I don't need you to do anything different. Just walk towards me. Perfect. Okay. Now I'm gonna get you to, on your tippy toes, walk backwards. Perfect. Perfect. And then on your heels, come towards me. Perfect. Okay. So her gait was steady. She is not uneven on her feet. Everything checks out fine. That concludes, if I get you to have a seat back down, Miss Bridges. That concludes the end of our assessment. Did you have any questions for me?
No.
Okay. Any concerns?
No.
Okay. The assessment turned out very well today. If you have any questions, please don't hesitate to call the office or to come back into the office and we can discuss any concerns that you may have, okay? Thank you, and that does conclude the end of our cranial nerve and our neurological assessment.